And so for me, whether it's ulcerative colitis or whether it's celiac disease or whether it's other autoimmune conditions, like rheumatoid arthritis or Hashimoto's thyroiditis, we're looking at the flare state and in the remission or recovery state. And so when working with the patient, we'll really talk about what are the symptoms that's happening right now. And oftentimes people who have been dealing with this for a long time will kind of know their triggers. So like for people with ulcerative colitis, like they'll, have a bout of constipation and then coupled with stress and then maybe some poor diet and insomnia. And like those 4 factors suddenly that's a perfect storm to lead to a flare. And so we'll work in terms of working with people, like it's really important to identify what phase they're in. Are you in a flare state? Are you in a post-flare recovery state? Or are you in a remission state? Or even are you kind of back to that like precursor, like on the edge state? And so really the symptoms that people are experiencing are keys to what's happening on the inside. So whether they're having diarrhea, that can be with or without blood and mucus, abdominal pain and cramping, rectal pain with bleeding, like weakness and fatigue, urgent bowel movements, there's the sensation that you have to have a bowel movement, but that you don't have a bowel movement, fever, loss of appetite, weight loss, nausea. There's such a broad range of symptoms for an ulcerative colitis flare. And when working with people, it's so important to really suss out what those specific symptoms are to them. And then also looking at the whole picture, like how's their body temperature? Like, okay, so maybe on a thermometer, you're running a fever or you feel feverish, but what's your body sensation? Are you hot? Do you have a steaming sensation coming from your bones? Do you have cold hands and feet? What's your thirst like, appetite? For women, like what's your menstrual cycle like? Like those are all really important information to get a accurate diagnosis and an individual diagnosis to what makes you, so we can give an effective and individualized treatment. Because to just say, okay, well, these are the points for ulcerative colitis, and these are the acupuncture points for celiac disease, and this is the herb formula, maybe 50% of the time it'll work, or you're just like, and that's because you're not looking at the individual and not taking that into account. And I can't stress how important it is to really understand each individual person.